We're just going to wait another 2 minutes. We have people who are still joining in. Thank you. All right, I think we're going to go ahead and get started. Thank you for joining us this evening. My name is Jess Fefferman, and I work for the Winchester Health Department. I am here with Jen Markham, who's the nurse leader of the Winchester School District. She's worked for the town schools for 11 years. And we have Jen Murphy from the Winchester Health Department, who is the director of the health department and worked for the town for 17 years. Tonight, we are going to hopefully shed some light and provide some clarification on the COVID-19 protocols throughout town and for schools, as well as share details on our COVID testing program. We're going to put up some slides so you guys can follow up along, and those will be available afterwards as well. The objectives for tonight are really threefold. First, what we want to do is really give you some background on COVID prevention strategies and talk about testing approaches, since the programs at the school are around testing. We also want to give some explanation around what to do if you're a positive case or a close contact. They're varying different types of close contacts, so we want to clarify that for you. And lastly, we want to describe the details of the Winchester Public Schools COVID-19 testing program. There are a couple different layers to that, and we want to let you know how to sign up. At the end, there'll be time for questions, and if you would like to ask questions as we go along, the Q&A function should be open. And I'm going to pass it over to Jen Murphy to start.
Hi, good evening. As we all know, there are various mitigation strategies to reduce the spread of the coronavirus. We've been dealing with the pandemic now for well over a year and about 9 months. And we are very familiar with some of these mitigation strategies like hand washing, physical distancing, masking. And no single intervention or strategy is perfect at preventing the spread of the virus. Each intervention has its limitations, as we all know, and that's why it's really good for us to all practice multiple layers of mitigation to reduce the risk. So where physical distancing may not be 100% effective at reducing transmission of the virus, we would also wear a mask, or we would wash our hands often, avoid crowds, and also we would get vaccinated when we can. And I would like to congratulate the community that we have such a high vaccination rate. It is truly amazing, and thank you so much for doing that. And we hope to see the next age group of 5 to 11-year-olds become eligible very soon, hopefully the end of October, early November. But right now we enjoy an 89% full vaccination rate in our community amongst those who are eligible to receive the vaccine. So that is just wonderful, wonderful news. And I think by employing these strategies, especially getting vaccinated, I think that's the reason why you're seeing a downward trend of our data, of our case rate. And you can find all of our data on our dashboard. Just to remind people, our dashboard is on our website at winchester.us. And you can find our positivity rate, our daily case rate, our weekly case rate, and some other data there as well. Moving to the next slide, we can see that there are different testing strategies that we can employ to detect the virus. One is surveillance, another is screening, and another is diagnostic testing. Now, surveillance testing is good when you want to test a particular population or a large group of people, and really do it at the same time. Routine testing weekly, for example, for COVID-19. And it really helps to let you know if you have a problem in and amongst that population or that community or that grouping of people. And it would be an indication to the tester that, hey, we need to look at this population even further because we think we have a problem where we have transmission occurring. So surveillance testing is a great way to monitor, regularly monitor a particular grouping of people. Screening testing really would tell someone that they have the potential to develop a disease when they're not exhibiting symptoms quite yet. For example, if you've been traveling to a high-risk place, internationally, whatever, and you get a test when you return, that's really more like a screening test. Now, a diagnostic test will tell you whether or not you have the disease, right? So, for example, we go, or people often go to get a PCR test, which we'll talk about in a minute, and that would diagnose whether or not that person does have the disease or not. It rules in the disease and it also rules it out in this case. Now, to drill down further on the types of COVID-19 tests out there, we know that there are PCR tests and antigen tests, and they both have benefits, and I'll just like to review a few little bits of information about each. The PCR test is a molecular test that detects genetic material, or RNA, and it's collected through a nose or a saliva collection method. Now, PCR test is known even now as the gold standard of testing because of its accuracy. It does have a high degree of accuracy. The disadvantages of the PCR test are sometimes the turnaround time for results can take quite a long time. I think most labs have fine-tuned that, and most people can enjoy a fairly quick turnaround time with a PCR test. However, it's just something to be mindful of. If you go to a testing facility, you may want to inquire before you have the test taken, just to see what the typical turnaround time is. If you've ever come to the community testing at Winchester Town Hall, you know that our turnaround time on our PCR tests are very quick, less than 24 hours, oftentimes less than 12 hours. So that is weekly testing at the town hall, just as a little plug and a reminder. There are also antigen tests available out there, and these are becoming more available, more widely available. These are a nasal or saliva collection. It's a test that detects for a specific protein from the virus. They're more accurate when there's a higher viral load in someone's body, but you do get a fast result. Antigen tests are more widely available. They are they have a high degree of accuracy when someone is infectious or symptomatic. The nice thing about antigen tests, as I said, they are widely available. You can purchase them for an at-home test. You can get them at local pharmacies. There was a scarcity for a while, but now that supply is ramping back up, which is great because at-home antigen tests can be really useful to somebody who wants to know for informational purposes their health status. Just know that one of the disadvantages of an antigen test is they're not generally accurate overall, but they are more accurate than they have ever been, and again, they are in wide use. The at-home tests, I do just want to caution people that they really are just for the individual's information. These are not official test results in any regard. For example, those results aren't entered into an official website at the Department of Public Health, for example. They're really just for the individual's own use. So, parents out there who may be listening, if you're taking these at-home antigen tests for your child, they can't be used for official purposes like returning to school or any other format like that. Medically supervised antigen tests are, if you go to a local AFC or urgent care, that's known as a medically supervised antigen test. Those results are actually official results. So I just wanted to point that out for folks. Now, what happens if you test positive for COVID-19? Now, test results go from a testing site or a lab to the State Department of Public Health down to the local health department. So at the health department, we receive all results through an electronic format with all the information of the person who has tested positive. When I say tested positive, we do get official antigen results, and we do get confirmed PCR results. When that person is diagnosed to be positive, we would call that person and impart some instructions. And one very important piece of those instructions are to isolate or remain at home and separate yourself from others. Again, the goal is to try to limit transmission at this point if someone is positive. And vaccinated cases may also from time to time test PCR positive, and if that's the case, they will be given the same instructions as well, to isolate, to remain in your home and separate yourself from others. Now, isolation period typically lasts 10 days, which is about the approximate time someone is infectious. And that infectious period is determined through an interview with the positive person to determine when the symptoms started, or if no symptoms, when that person truly tested positive, was confirmed to be positive, we would calculate the infectious period. And that person would be told to isolate during the infectious period, which may be in general 10 days, could last longer depending upon the duration of symptoms, but in general, 10 days. And we would advise you to only leave your home to seek medical care. In other words, don't go to the mall to go shopping if you are infectious and positive. That would be a bad idea. And so again, the health department, or sometimes the contact tracing collaborative would contact a person, and the contact tracing collaborative is a contracted agency by the State Department of Public Health. But by and large in Winchester, you would receive a call from the health department, a contact tracer who works for us. And we would give you this guidance over the phone. And so please, when you get a phone call from the health department, we urge you to answer your phone, because getting all of that important information from you, for example, when your symptoms started, is a critical piece of trying to limit transmission and trying to contain the spread. So how do you know you're a close contact of a person who tested positive? Well, again, like I said earlier, we determine the infectious period of a person who tested positive. And then we try to figure out through the interview who that infectious person has been around. We then contact those people who are deemed to be close contacts. And if you're called and told you're a close contact, it simply means you were within 6 feet of a positive person in an indoor setting for at least 15 minutes over a 24-hour period. And again, that's a cumulative 15 minutes. So cumulative 15 minutes over a 24-hour period. So that's how we determine whether or not you are a close contact to an infectious or positive person. And so the health department would again call all close contacts to again impart instructions to the person around quarantining. But one thing I would like to point out first is, again, you're a close contact if you were around a person who was positive in an indoor setting. This is very different than from where we started a year ago. A year ago we included outdoor settings, but nowadays you really truly are not considered a close contact if you had exposure in an outdoor setting. We have, over time, public health data has told us that the risk of transmission in an outdoor setting is so low that we don't pursue that through contact tracing any longer. Now, what happens if you are a close contact and you receive the call from the health department? Now, don't forget, if you're a close contact, it means you have the potential to develop the disease. So it's very important that you follow the instructions that we give to you. And it does include staying at home. It includes using a separate area of the house if possible. For example, a separate bedroom, a separate bathroom if possible. Really just do your best to stay at least 6 feet away from other people in the house. And so it's important that since you have the ability to develop COVID-19, you don't have visitors over, you don't attend family gatherings, you monitor your health for symptoms every day. If you have any changes to your health, perhaps you're becoming symptomatic, it's important that you go and get a test. So right here on the slide, you'll see the difference between isolation and quarantine. Again, isolation means you are confirmed COVID positive. Quarantine means you're a close contact and you have the potential to develop the disease. And it's very important if you're a close contact, again, to follow the instructions that you're given. I know nowadays we use the term quarantine a lot for both sick people and close contacts, but really this is the differentiation here, as you can see. Now, what if you're a close contact outside of a school setting? In other words, you haven't been around a COVID positive person in a school building or a school activity. You were exposed, let's say, at someone's house during a Boy Scout meeting over a weekend, for example. Well, what happens? If you're an unvaccinated person, the instructions are different than for vaccinated people. Let's start with the unvaccinated people. If you're unvaccinated, and many kids are, obviously anybody under the age of 12 doesn't have the ability to get the vaccine as of yet, so the instructions are gonna be that you quarantine at home, and you can end your quarantine after 7 days. So there's sort of a test out option to this quarantining. If you test negative on the 5th day or after, you can actually end your quarantine as long as you're not experiencing symptoms after the 7th day. And it's a lot, I know it seems a little confusing now, but just know that there is an option to get out of quarantine if you're not experiencing sickness, you have no symptoms after 7 days. So that's the good news. And then if you're vaccinated, the news is even better. You're not required to quarantine at all if you have no symptoms. So if you're vaccinated, but you were around somebody who was positive, again, there's no quarantine for a vaccinated person as long as you're not sick. What we ask, though, is that you monitor for any symptoms over the next 14 days from exposure. And if you feel ill at all or notice any symptoms, to get tested right away. It's a good idea to also wear a mask in indoor settings, just because you don't know whether or not you could potentially develop the illness. We have had some breakthrough cases. Those people have fared very, very well. And we are seeing, as I mentioned, we're seeing our case rate decline, which is just incredible news. And we hope to have more vaccinated people even sooner as the eligibility age decreases.
Thank you so much, Jen. That was very helpful, and that really is going to set the stage for what Jen Markham's going to talk about as things are related to in-school. We did get a question that came in about some school-related rules around close contact, so that is going to be up next, so I wanted to let you know. I also wanted to let you know, if you're watching at home, if you go on to view, you want to put it on speaker view just in case you aren't in full screen right now. It'll be easier for you to see the slides. So I'm going to pass it over to Jen Markham, who's now going to talk about more school-related protocol and the program.
Great, thank you. If your child is determined to be a close contact in school or during a school activity, and again, as Jen Murphy mentioned, this is not during an outdoor setting, but this is actually being inside a building. I'm just going to review a couple of important points about this. So if we learn that there's a positive case in our school community, we work very closely with our health department to determine if the positive case was infectious while in school. And we do this by determining, going over onset of symptoms, as Jen was mentioning, onset of symptoms, and also test dates. If the person is determined that we determined they were infectious at school, we begin the very thorough process of contact tracing. We look at seating charts, we talk to teachers, and we really try to, determine the children that are close contacts. If your child is identified as a close contact, unvaccinated, and at 0 to 3 feet from the positive person, your child will be required to quarantine, and that is, as Jen was mentioning, the 7-day quarantine with the option of coming out of quarantine at day 7 with a negative COVID test after day 5 of exposure. So just exactly what Jen Murphy was just kind of going over. If your child does actually qualify for test and stay, and that will be on our next slide, your child will actually not need to quarantine. So we have our COVID-19 test and stay program. If your child is determined to be vaccinated or unvaccinated at 3 to 6 feet from the positive person, you will receive notification. And actually, I need to premise that in both scenarios, you will be notified. So if your child, we do contact tracing, and we determine that your child is a close contact, unvaccinated at 0 to 3, or vaccinated, or unvaccinated 3 to 6, in both scenarios, you will always receive notification from the school, and that will be via email. So you, again, if they're 3 to 6 feet, they will not be required to quarantine unless your child becomes symptomatic. So if no symptoms, there is not a quarantine requirement. However, we will go over with you that it is very, very important to monitor for COVID-19 symptoms for 14 days following exposure. If symptoms do occur, it's important to keep your child home, isolate, seek testing, and contact your child's primary care provider. Also, it's important to let your school nurse know, so we're aware of what's going on. When we are doing close contacts tracing, we do not have to worry about outside exposure, example during recess, and also when on the bus, because windows are open on the bus and kids are in masks on the bus, and we will review that when we are contact tracing. So this slide, I'm going to get into actually our test and stay program and who qualifies for test and stay. So unvaccinated individuals identified as the 0 to 3 foot close contact to the positive person during, again, indoor at school activities can qualify for test and stay. Students have to be asymptomatic. That means they cannot have any potential COVID symptoms. So asymptomatic students can participate in test and stay, again, if they're unvaccinated and they're determined to be a 0 to 3 foot close contact. You will receive notification if your child qualifies, and then at that point you can determine if you do actually want your child to participate in the program. Your child will need to be registered, and that we have a registration site, and you are signing consent that you want your child to participate. So once we have consent and we know that you want your child to participate, you'll get an email just to go over test dates and where your child should go in the morning to have the testing, and also we'll kind of lay out the dates that your child will be tested, which is up to 5 days. So we use the Abbott, we use a Binax Now rapid antigen test, and we use nasal swab. It's a gentle nasal swab. The results are done are back in 15 minutes. And again, we test for at least 5 days when your child returns to school to make sure that the test results are negative, and also to make, we're going to also make sure your child's asymptomatic. If your child is in the test and stay program, and the morning of one of the tests, your child is displaying any kind of COVID-19 symptoms, your child must stay home. They are no longer going to qualify to remain in the test and stay program. So to wrap up, the test and stay allows your student who is a close contact to stay in school. This slide is an example of a test and stay scenario. So a 6th grader who is not eligible for a COVID-19 vaccine is exposed to someone in their classroom who tested positive for COVID-19. They were within 3 feet of them for more than 15 minutes. This qualifies your student for test and stay. So again, you would be notified if you say yes to test and stay. Your child can continue going to school, again, if no symptoms, and if every test that your child is being tested with the Binax at school is negative. This will allow your child to avoid missing school for up to 5 days. It is very important to note that quarantine is required outside of school, but your child can attend school and school-sponsored activities. So for example, if your child is in a school-sponsored band or a club or sports team, your child can go to school and then attend their after-school sponsored activities. And I think it's really important just to kind of explain the rationale. So during school and school-sponsored activities, these are supervised events. You know, in school, there's teachers and principals and school nurses reinforcing our important mitigation strategies, such as wearing a mask and physical distancing. So during these settings, we have, you know, more confidence that there's less transmission, there's less risk of transmission because the children are masked versus, you know, leaving school and going to a friend's house, which very often, you know, kids are not wearing masks in homes. So that is the rationale why the children are allowed to attend school and school-sponsored activities, but outside of that, they need to quarantine. If you learn that your child qualifies for tested stay, again, you've been notified that your child is a 0 to 3 foot close contact, not vaccinated, and you choose not to do test and stay, your child will need to follow the full quarantine, and that includes not attending school. Again, just to go over the quarantine, it is a 10-day quarantine with the shortest duration of 7 days if your child has a negative COVID test at 5 days or later after last exposure, and also not showing symptoms. They could actually end quarantine, you know, midnight of their 7th day and return to school on day 8 if the health department clears them. But if they're not enrolled in test and stay, this means they could potentially miss up to 5 days of school. They cannot participate in school or school-sponsored activities. This slide goes over our weekly safety checks, and they were formerly called pool testing. They are now called weekly safety checks for COVID-19. We are starting our weekly, we actually started weekly safety checks. It's a free weekly COVID-19 testing program to help keep our students and staff and community safe and to help prevent the spread of COVID-19. With our safety checks, we are lowering the risk of disease in our school by finding positive cases of COVID-19 quickly. We can identify positive cases in people who do not show any symptoms. It's actually helping us keep our regular in-person learning while making everyone feel safer at school. It's important to note we do get a lot of questions about if a staff member or student is vaccinated, and yes, they may participate in the weekly safety checks. It's also very important to note that this is only for asymptomatic people. So if someone is not feeling well, they review the symptom checker, that person should not be coming to school or to work, and they do not qualify for safety checks. So it's for asymptomatic people only, not showing any symptoms.
Great, and now this is Jess. I'm just gonna go over the next couple slides. So talking more specifically, and we can keep the slides up, would be great. We're gonna go over the weekly safety check approaches. So we have 2 different ways that we're doing this. For the elementary schools, K through 5, we are doing the testing in school, and we are doing a shallow nasal swab, which is painless and easy to do. A question already came in about whether kids are doing this themselves. The majority of kids are in fact able to do this themselves. We're just starting right now with 3rd through 5th. So those kids are really, for the most part, able to do it themselves. We do have trained staff who are able to do it for them if they're not comfortable or for other reasons. So K through 5, we've just started rolling out. We've started with 1 school so far. We have another elementary tomorrow. And in the coming weeks, we're working with staffing, and we're gonna be ramping up all the different schools and adding in the entire K through 5 classes. One thing to note about this and why these weekly safety checks are different than what was previously known as pool testing is at the lab, the swabs and samples they may be pooled together to actually be tested there, but they have the ability to automatically retest and identify who the positive individual person will be. So you will not end up finding out there's a positive pool. You will only find out if there is one individual that is positive. Nobody's getting quarantined because someone else got tested positive. You will only be notified if you as an individual are positive. And for 6th through 12th grade, we're also doing weekly testing. It's a little bit of a different model. where they get saliva kits. We just started this yesterday with 6th grade at McCall. They brought home their kits yesterday with directions. And I will say for both of these, if you go onto our website, there's videos on how to do how the nasal swab is done, and there's a video on how to do the saliva collection. And so that will be happening on a weekly basis. Students who would like to participate, provide a sample, drop it off at school Wednesday morning, and we're looking to roll in the other grades in the upcoming weeks as well. One important thing to note, as this is surveillance testing, no news is good news. There's not individual reported results. The only time you will be contacted directly is if you have a positive result. And if you miss a week, if your child isn't in school for a day, if they forget their saliva kit at home, not to worry, but they can just participate again next week. So now I want to talk about how to register. What you can do is if you go to the winchesterps.org website and you click on the button that says COVID-19 resources, you can scroll down and there's an entire website dedicated to the COVID-19 testing program. So if you have not seen that, I know questions come in and how do we register? Everything you need to know is right there. If you know of someone who doesn't have access to computers, we can make paper consent forms available at all the schools. We have consent forms in different languages available. We have program overviews that have been translated. Thank you to our English language director at the high school has translated documents for us. So anyone who needs different types of documents, and we're actually even hoping to translate this presentation tonight. So please know that we will make that available. When you go to the website, you'll see it says student and staff registration here. You click right on that. And it is a state-funded and state program overseen by the state, so you will have one consent form to participate in all the different programs. And I want to clarify because this question comes up a lot. So that does mean that you're consenting to be in all the programs. However, in Winchester, we have made it possible for people who don't want to be tested in the weekly safety checks to opt out. And you can also find that information on this front page. You have to click where it says, if you want to opt out of weekly safety checks, you need to click there, and there's more information there. And that is a process that we are working on to make sure that it's as efficient and effective as possible. And with that, I think I'm going to pass it back. Was there anything else, Jen, on registration? I know, again, for the test and stay, I will say another question did come in. So for test and stay, even if you've already consented, we are absolutely going to notify you before your child is tested for test and stay, because you have the option to, even at that point in time, even if you've consented, to say, you know what, I'd rather my kid was exposed, I'd rather keep them home for the 7-day quarantine, and I don't want them coming to school every day and getting a test. So you are notified individually for the test and stay. However, if you're consented, if you sign the general consent form, please do know that unless we've heard from you otherwise, your child will be tested in the weekly testing program. And now I'm going to pass it back to Jen Markham, who's going to do our closing slide.
Great, thank you. So I just feel like it's important to end, to review our very important mitigation strategies, our school safety measures, with our goal to limit the spread of COVID-19 in our school communities. And I do want to just reinforce the importance of people staying home when they're sick, particularly, staff and students. So if you, on our website, the winchesterps.org, there is a COVID resource button, and that is where our symptom checker is found. And, I think it's very important for people to print it and really just put it on your refrigerator and look at it every morning before you send your child to school. Any symptoms of COVID, please keep your child home and call the pediatrician for next steps. If your child is staying home due to potential COVID symptoms, it's important to know that we do have to clear your child to return to school, and we do require a negative PCR test. And also, with that, we also want the symptoms to be much improved. So if your child has a fever and a cough, we of course want the negative PCR, but we want the fever to be gone for a minimum of 24 hours, and we want the cough to be much improved. If your child is seen by healthcare provider and there's an alternate diagnosis, maybe an ear infection or strep throat, and the doctor feels that that is the reason for the fever, then we will take a medical note saying that there's been an alternate diagnosis. And as long as we have that alternate diagnosis, we do not require the PCR. But those are just very, very important measures. And honestly, it's you know, we've had very few cases, so I feel like this mitigation strategy is very, very important and is working very, very well. Also, of course, masking. We're wearing masks in the buildings, and that is to decrease the spread. Physical spacing as feasible. You know, we're really trying to maintain that 3 feet from people as much as possible. And of course, hand washing and hand hygiene. So we continue to have more portable sinks and hand sanitizing stations. And, you know, these are all strategies to help us keep our buildings open with our kids in schools. And we're proud of the efforts, and thank you for continuing to work with us on this.
That's great. Can I also add, in terms of trying to stay healthy this upcoming fall and winter season, I would like to just remind folks about the importance of getting your flu vaccine. Thank you to all the parents who signed their kids up for our school-based flu clinics. That's a joint collaborative effort between the schools as well as the health department. So we'll be holding those flu clinics in school. That registration has closed. However, if you missed out on that, please go to the winchester.us website and sign up for a public clinic. We have 4 public clinics that are upcoming, and so I encourage you to take advantage of that because the flu vaccine is very important. And just to let you know, we have flu mist and the flu shot, but we also have high dose for the seniors out there, 65 and older, so please take advantage of that.
Great, thank you. So we are going to move into our question and answer. One of the things that I wanted to say in the beginning was, and no questions I think came in on this, but if anyone is looking for specific information on the number of positive cases we've had in Winchester or in the schools, please know you can also actually get to it by going to the winchesterps.org and click on the COVID-19 resources, and there are links to the dashboard for the schools, and there's also a link to the town website, which has data and information about the flu clinics as well can be found on the town's website. So we're gonna just start going through some questions. The first one was asking about whether the guidelines in the beginning, Jen Murphy, that you had shared, whether anything has changed or been impacted by Delta from a guideline standpoint.
So while Delta did create a bit of a surge this summer, and we did see an increase in our case count, the protocols around what to do regarding isolation and quarantine didn't change. You know, a positive is a positive. That applies to people who are vaccinated, unvaccinated. So if you're positive, you have to isolate. And if you were exposed to a positive person, that quarantine protocol only changed if you were vaccinated. That was the only different set of instructions that you had, but those who were unvaccinated and exposed to a positive person had to follow the quarantine instructions. I hope that answered the question.
Great, thank you. The next question is around the bus, which I don't know that we can fully answer here, but it wants to know about, are the windows on the bus always open? And that is what they are supposed to be. Students' masks, windows open. If there is a concern about that, is there someone we should direct people to around that specifically?
So part of our contact tracing is going over who's on a bus and just reinforcing that the windows are always to be open and the children should be in masks. So that is part of our training, and that's the expectation, and we do review that when we're contact tracing.
Great.
But if someone had a concern,
Oh, if they had
someone had a concern about it. So I mean that's something.
Should they call the principal perhaps?
I think there's someone for I think actually if you go on the website, there's someone under transportation that you should contact, because we do want to make sure that the guidelines are being followed and the windows should always be open. Mm-hmm. Some of these questions we've already answered about, again, the notification for test and stay, just to be very clear, if you are identified as an in-school close contact, you will receive a notification from school giving you the options of whether you want to do test and stay or a regular quarantine.
Right, and we actually, on the email, we actually asked the parent or the guardian to respond, to verify that they received the email.
Yes, absolutely. That there are certain communications that are sent out that are notification only. So for example, if someone who's vaccinated or the 3 to 6 foot close contact, we would absolutely notify you, but that doesn't require a confirmation back. Whereas if you are identified as a close contact that needs to quarantine or has the opportunity in test and stay, we absolutely need to get in touch with you because your child would not be able to go to school. A question, yeah, go
Sorry,
ahead.
can I clarify one thing?
Yeah.
And I may have figured out the last question you gave me.
Yeah,
So the definition of a close contact has not changed. It's still the within 6 feet, 15 minutes over a 24-hour period. What has changed is that DESE, or the State Department of Education, has carve-outs and exemptions to the full quarantine. And that's to allow kids the chance to stay in school and continue learning. So the test and stay program is one opportunity for a child to be tested to be able to stay in school. So DESE has given these carve-outs to allow for close contacts in certain circumstances to remain in school, meaning they're asymptomatic, they're in the test and stay program and continue to test negative. But the true definition of a close contact, again, hasn't changed, which is why Jen Markham, clearly stated that, when they do their contact tracing for the student, they do take into account that 0 to 6 foot rule, but try to figure out and decipher who is 0 to 3 and who's 3 to 6, because it makes a difference in the instructions and what comes next.
great. That was a great clarification. Thank you. We did get a specific question about if a student misses school because they test positive, about being able to make up work. And that's really something specific where your child would need to be talking to their teachers and their schools. I do know that that's something that is top of mind and being taken into consideration of how students can be able to get work done when they are either quarantined. But again, the test and stay program is an opportunity, not if you're positive, but if you're a close contact, to remain in school. We have a question about when can K through 2 start, and hopefully as soon as possible. We are ramping up as quickly as we can with limited resources. So the schools are individually starting to communicate out to the grades that are able to start. And again, the next few weeks is just going to be 3 through 5, and then we're very much hoping to add in the K through 2. A question did come up about swabbing with a kindergartner. So a kindergarten actually could swab themselves. That's just going to be on a case-by-case basis on whether they are comfortable. So I did want to clarify that. So here is another test and stay program question about someone who initially is testing negative the first few days, but then on day 4, they are positive. So how are close contacts considered or identified in that case? Do you want to take that one?
Sure. So we would, if the person tested positive on day 4, of course, we would treat it as a positive case. That child would go home. And then we would work with the health department to do contact tracing. So we would just treat it as a positive case, and the kids are in masks, but we would do the same thing. Nothing would change. We would just do our thorough contact tracing, just as if we learned, in a different way.
Great. This question might have come after we presented on what constitutes an in-school close contact. So I don't know if you want, I was going to say we could put up that slide again just to show it for another minute, and if when can we put up that slide?
Sorry. One more, I think. I don't know what number it is.
It's back towards out of school. So it goes fast. All right.
Okay.
So the in-school close contacts are in these 2 different categories. So for the person who asked the question, and the question also asked about if they are wearing masks. So it's regardless of whether they're wearing masks, they still would be a close contact. So hopefully that answers that question. We are coming towards the end. So what protocols are being taken in some of the smaller classrooms that were not originally meant to be classrooms for 20-plus students? That's something, I know that spacing in all classrooms to the degree possible is being taken, and ventilation. So I think all the different things that we've already shared. Don't know if there's anything additional on that.
Right, I mean, DESE does want all children back in school full-time. So we are following the guidelines, and we are working really hard to, ensure that the kids are at 0 to 3 feet as feasible, as much as possible. So if you have a specific concern about a particular classroom, I would encourage you to, reach out to me or the building principal, but because I don't know all the details and I don't know what building, but, we're doing the best we can. In some situations, it can be more difficult.
So, and again, one thing that we didn't mention in the beginning, I know we weren't going over the number of cases, but we have not this year seen any school spread,
Correct.
which is really something, a testament to the two people sitting here who, from a health department standpoint and from a school standpoint, are working really hard every day to make sure that they're keeping our community safe, and they are really proactive. Again, when a close contact or a positive case is identified and there's close contacts in school, you have contact tracers from the health department working with school nurses very closely to identify anyone who could be impacted and quarantine them, so we're minimizing the chance of spread. So I think that's something to really feel good about. Another thing, again, we talked about our high vaccination rate. Someone did ask about how we know if kids in school are vaccinated, and there are systems where we're able to check when we need to, because it makes a difference. Obviously, if someone is vaccinated, if they're able to be vaccinated, they don't have to quarantine in school. So that's a really important take-home message, I think, for families out there, and especially people who have kids who are 7th through high school, that if they are vaccinated and they're exposed to a close contact, as long as they don't have symptoms, they can stay in school.
Mm-hmm. And there's a registry throughout Massachusetts where all health providers are required to report any vaccines given. So every time you or your child receives a vaccine, it does go into this Massachusetts registry system, so that we are capable of looking up the vaccine status at any time.
Great. And I think we only have, there's one last question. So if people have other questions out there, feel free to type them in. But this last one was just about where the tests, I think for the weekly safety checks, are taking place. So again, it depends. If you are in K through 5th grade, those are going to be taking place on site at school. And if you are in 6th through 12th grade, you have the opportunity to take those kits home with you and you bring them back the next day. Again, I encourage you, if you have any questions about the testing program, the website explains all the different aspects of the program. There's frequently asked questions, and if you do have questions after tonight, there's a form that you can fill out. We are getting lots of questions and responding as quickly as we can, so just please be patient. It may take up to 48 hours, but you can fill out that form and the question will go to us, and we will make sure that someone on the team responds to you. And I'll end with this last one about receiving, someone wants to know if they will receive an email when their 1st grader would be tested in school. So again, the school is communicating when we are bringing that weekly testing to school. If you have consented to the testing program, your child will be tested unless we hear from you otherwise, or you have opted out. So if you've consented to the program and testing is happening at your school, your child will be tested. So I think that's going to wrap it up. Thank you, everyone, for coming tonight, and thank you, Jen and Jen, for all the work you guys are doing to make this possible.
No, thank you too. We are surrounded by competent and fabulous people, so it's a group effort. It's a team effort.
Definitely a team effort.
Thank you. Have a good night.
Thank you.